Hi, my name is Amanda Mavraj, and I reside in Brooklyn, New York. I have a Bachelor's of Science in Nursing and a Master's in Public Health. I have been a public health nurse for 4 years, currently working at New York Presbyterian Methodist Hospital in the Med-Surg Neurology Unit. On my spare time, I'm also a home care infusion nurse where I provide infusion to patients who currently have long-term antibiotic usage or who have recently been diagnosed with cancer and needs long-term chemotherapy infusion. In addition to being a nurse, I am a wife as well as a mother to a newborn 1-year-old baby girl. In my spare time, I do give back to my community where I reside. I help them get groceries, especially during COVID, providing them with groceries with their needs, as well as providing them medication reconciliation, and also helping them understand what COVID-19 is and how it can impact them and how it's impacting our life. The reason why I chose to become a nurse was because my dad suffered from a heart attack when I was 10 years old. Feeling that helplessness that day, I knew that I never wanted to feel that helpless, and I wanted to give back to those who are not able to help themselves. I'm dedicated to caring, curing, and making a difference every day. To be a nurse allows me to provide one-on-one care to people who are the most vulnerable. I'm able to be a support system and help aid them back to optimum health. To be a nurse means I can change a patient's worst outcome, their worst day, into a better day, into a better outcome. Within 5 years, I want to become a labor and delivery nurse, where I can provide behavioral and theoretical knowledge as well as clinical skills to those who are giving birth. Within the Black community, there is a severe maternal mortality and morbidity rate among women of color. This is persistent and has been long-term and long-lasting problem within the Black community. Disparities in maternal mortality within the United States, especially in New York City, amongst Black women are 12 times more likely to die than white women who are pregnant. I'm dedicated to changing those disparities, to working to eliminate those disparities within the Black community and within Black women. As a mother and giving birth to my own child, I was at risk as a Black woman, so I want to give back to Black women, to Black mothers who are disproportionately represented within the community of giving birth. My mission is to inspire, my mission is to mentor, and to provide quality health care within my community by bridging a gap and working towards eliminating disparities that exist within the Black community. I constantly am motivated by my family, by my community, by my patients. With this $50,000 grant, I'll be able to further my career. I'll be able to pay off my student loans, and that would allow me to further my career so I can become a family nurse practitioner within the nursing field. Nurses rock. We work very hard to help others, and with this $50,000 grant, it would allow us to give back in a great way. And I thank you, FIGS.